Mitral regurgitation is a very hot topic at the ESC Congress that we have today. There is a lot to learn about mitral regurgitations because we have new devices that we can implant percutaneously. We have clips, we have annulus, we have prosthesis, and for all this new treatment of the mitral regurgitation, we need imaging. We need echocardiography, we need 3D echocardiography, we need CT, we need CMR. So for the imager community, it's very important to take into account these new things that we have for the mitral regurgitation. So we have to best assess the severity of the mitral regurgitation. We have to know how severe is the regurgitation. We have to understand the mechanism of the regurgitation because it might impact the treatment. And also we have to assess the consequences of this mitral regurgitation on the LV, on the LA, and the right ventricular function and pressures. So it's very, very important to learn more about mitral regurgitation. And just to take an example, a few weeks ago we got two studies published in a New England Journal of Medicine. One is mitral-FR, one is COAPT. The first one is a French study, a randomized prospective study about the clip in the secondary MR. The results were negative. And the second one was done in the US, and the results were extremely positive. Why that? Because in France, we implanted clips in patients with very severe LV dysfunction and some degree of MR. In US, they implanted clips in patients with less severe LV dysfunction, but much more severe mitral regurgitation. Why that? Because the recommendation that we have in Europe and the recommendation paper that we have in US are not exactly the same when we discuss about secondary mitral regurgitation. So we really have to reconsider the mitral regurgitation, the primary mitral regurgitation of course, but also the secondary mitral regurgitation to best understand this mitral regurgitation. In a few weeks there will be a paper published in Circulation or JACC, I don't know yet, about the importance of cardiac MR. Because in that field also, of course, echo is first. But cardiac MR might be very interesting because thanks to cardiac MR, we can quantify the LV fibrosis. And for secondary MR, it seems that it's very, very important to quantify this degree of left ventricular fibrosis because more fibrosis you have, more severe is the LV dysfunction and less effective will be the treatment of the mitral regurgitation. So nowadays when we discuss about mitral regurgitation, we not discuss only about quantifying a regurg, we discuss about quantifying the regurg, of course, with new softwares, 3D softwares, with CMR, but also we have to focus more on the mechanism of the mitral regurgitation and on the consequences on the LV, but I should also discuss about the LA because we know that in some patients the LA is highly enlarged, there are some degree of fibrosis in the LA, some patients develop atrial fibrillation, and all these aspects might impact the way we treat the patient.